Over to you.
Okay, great. Let's see. Are you guys seeing my full slides or this presenter
Y-
view?
Yes, we can see your full slides.
Okay. So I am really excited to be with you all today to talk about using qualitative research methods in social epidemiology. I come with a little bit of an interdisciplinary background, but primarily function as an epidemiologist. And over time, have really found qualitative methods to be very useful in my research. So just our agenda today, a brief introduction to qualitative method research, when to use qualitative versus quantitative, going over some data collection methods, and then analyzing qualitative data. And then in the end, I've snuck in a couple of examples that of where I've used qualitative methods. So just to kind of introduce myself to you all, so I am an associate professor at the University of North Carolina in the United States, and my research over the last 20 years has, from the social aspect, focus on concepts of life course, weathering and health, looking at racism, colorism, which is also known as skin tone bias, and other appearance-based forms of bias and their impact on health, and then thinking about place, neighborhoods, and health. And I've done this over a variety of health outcomes. These are just some of the broad areas in which I've worked in, but I have found the further I have gone into these sort of top three squares, the social determinants of health, the more my research has required me to utilize and respect qualitative methods. Okay. So for those of you who aren't as familiar with qualitative research, let's kind of give us a foundation. So, qualitative research is really a systematic approach to understanding meanings and experiences and social contexts, but using non-numerical data, right? So just like, our quantitative data that epidemiologists are very used to and honoring the systematic approach, qualitative work also has a systematic approach, and we have to honor that. It values depth and subjectivity. They're not, depth and subjectivity are not really limitations of qualitative work because it's part of the process. Because it requires you to honor the depth and subjective nature of that non-numerical data in order for you to interpret that data. And then what's really great about qualitative research is that it's really useful in social epidemiology because it helps us to uncover nuanced insights about health behaviors, cultural influences, and social determinants of health more broadly. And then something to be very mindful about with qualitative research is that it involves an iterative data process. So, you go through data collection and analysis often occur simultaneously, not one after the other, like in quantitative research, where we do the data collection and then we do the data analysis. So with social, why do we want to use qualitative methods in social epidemiology? And it really sort of boils down to being able to illuminate or understand how people experience conditions like discrimination, housing insecurity, or unsafe neighborhoods, and other lived experiences behind social phenomena. Qualitative methods also help us to center the experience of marginalized groups. And this is really important when marginalized groups are often excluded, their voices are often excluded in research for multiple reasons. But one of the ways that I often think about the way that their voices are excluded is when we have these large population-based surveys or studies, and the marginalized population may, their numbers may be relatively small, and so there's not enough, the group isn't large enough for us to do, subgroup analyses, and so they often wind up being excluded from those subgroup analyses. And so we don't really, in quantitative data, they're less likely to be well characterized, because we have to think about sample size when we're trying to do subgroup analyses. And with qualitative research methods, small sample size isn't an issue, right? Because we are interested in depth and nuance, right? And so it's very easy, or it's very amenable to centering experiences of voices that are often excluded in research in various ways. But we also may want to use qualitative methods to explore mechanisms and pathways that link social conditions to health. So maybe a particular pathway between a social condition and, I'm going to just use the a birth outcome, preterm birth, is not well elucidated, right? Qualitative methods are a really great way to uncover unexpected mechanisms. So, for example, thinking about how fear for a Black, so in the United States with racism, we often think about Black mothers often have concerns for their sons' safety, and want to protect them from, future experiences of discrimination. So how does that fear or that anticipation of discrimination towards their child shape maternal stress during pregnancy, right? So we may want to try to explore that with qualitative methods before we even try to assess that with quantitative methods. And then also capturing domains that surveys are often miss. So thinking about concepts like identity threat or neighborhood dynamics, institutional processes. And then something that's really important to me, and I will show you an example of this later, is using qualitative methods to strengthen our conceptual frameworks and improve measurement validity. So this is I think a really nice table that compares qualitative and quantitative methods and the roles that each of them serve. And note that it's not, while I have qualitative versus quantitative methods, note that it's not an either or in your choice of use or in terms of which one's better in general than the other. I would say that neither is, overall better than the other. They are complementary to each other and in the process of research, and each has its strengths, and the strengths are dependent upon sort of the purpose that you the purpose of your research, right? So when we think about qualitative research or think about purpose, right? Qualitative research helps us explore meanings, where quantitative research allows us to measure relationships on a larger scale, and also allows us to, if our data is representative, make generalized inferences. The sample size for qualitative work is small and it's purposive, right? Because you are trying to explore meanings or new concepts within a particular segment of your population. In terms of the data types, right? Qualitative is about words and narratives and pictures, whereas quantitative is numbers and metrics. And then I think most importantly is thinking about the process, where qualitative, actually I have these kind of swapped, in that qualitative is actually iterative and nonlinear methods, and quantitative is fixed and linear methods. So just a little error to note on that slide. So just to kind of summarize when to use qualitative methods, we want to use them when we're trying to understand lived experiences and cover personal and cultural experiences that may be less understood, or we want to identify nuances within these personal and cultural experiences that may impact health and social behavior. They are great when we are exploring social determinants. So I do a lot of work looking at discrimination or unfair treatment, and I've used qualitative methods to think about the different forms, to better understand the different forms of discrimination that people experience, how discrimination may operate differently based on your identity, your appearance, where you live, that sort of thing. And then qualitative insights are really great to guide the development of interventions that address structural and cultural barriers to health equity. So I'm not going to go through this slide completely. It's sort of a summary of what I went over in terms of when to use qualitative versus quant methods. But I thought this is a really nice way to kind of look at the uses, especially I think the first bullet under each of the different forms of methods, right? So in epidemiology, we're often thinking about the prevalence or the burden of a health condition. We're thinking about magnitude, and we're thinking about strengths of associations. But in qualitative, again, we're thinking about understanding mechanisms or processes or identifying new concepts. So each has their own purpose. And sometimes we use them separately, sometimes we may use them iteratively, and sometimes we may use them in an integrative way in our research. So qualitative methods or qualitative research involves the application of qualitative techniques with a qualitative paradigm to pursue research goals. So qualitative research, we can think about it from this paradigm with these dimensions. So it's there for like in-depth understanding, or we use this paradigm to increase our understanding from so that we have a deep, so that understanding can be deep and rich, and it allows us to do that with really complex phenomena, which may be very difficult in quantitative data. It allows us to capture insights into participants, not just their experiences, but also their behaviors and even emotions, right? So it also helps us to do contextual exploration. Qualitative methods are very flexible in their nature. They enable researchers to adapt the methods and questions as new insights emerge during the study. And so qualitative research is often seen as being very responsive and dynamic, which is one of the reasons why it is great to use when you're trying to center marginalized populations. Another reason it's great to use when you are trying to center often excluded voices from research is that it focuses on the participant's perspective, or it prioritizes participants' perspective. Qualitative methods are very useful in the development of new theories, and then again, just that data richness. So there's several types of qualitative data collection approaches, but I'm just going to go over 3 of the most common data collection methods, and that's interviews, focus groups, and observations. Interviews can be structured or unstructured, which allows the researcher to have a little bit more control in terms of the depth of exploration of individuals' experiences and insights. So an example of a question in an interview might be, can you describe your experiences in accessing prenatal care? Or what factors influence your decision to seek healthcare in your community, right? With focus groups, we are capturing collective views and social dynamics by discussing shared topics among participants. So an example of a prompt in a focus group might be, what challenges do families face in maintaining healthy diets, right? And so what's really great about focus groups is that you're not just having this one-on-one conversation, but in having this conversation within small groups of people, sometimes what happens is that a focus group participant may bring up an example of a challenge that another focus group member wouldn't have initially thought of on their own, but it is very relevant to them. And that helps them to think about how does that barrier or that challenge affect their family in maintaining a healthy diet, for example. And then we have observations, right? In which observations involve studying behaviors in natural settings under social interactions and environmental influence impacts. And you can do this within clinics, community events, and other public settings. So just to kind of few additional notes on each type is that interviews tend to be that one-on-one, between the participant and the investigator in that exploration of personal experiences, beliefs, and perspectives in details. Interviews, a strength of interviews is that they are very flexible. And what they do is they allow the interviewer to build trust. But a limitation for them is that they can be time consuming. And they may not be suitable for capturing group dynamics or group experiences. That's where focus groups and even observations may be better or more suited in social epidemiology. So in-depth interviews they're really helpful. As I said earlier, they're really helpful in exploring personal narratives and sense making of phenomena that are less characterized. They're ideal for sensitive topics. So discussing experiences of racism or other types of marginalization or oppression, trauma, sensitive topics like reproductive coercion. They're also helpful in exploring topics like housing or food instability that may elicit, people may feel some shame about. So in terms of sampling, interviews can be purposive. You can maximize variation in terms of who you sample or the sampling strategies you use to ensure that you capture a range of diversity of voices and personal narratives. Or you can use snowball sampling, which is helpful in trying to find those hard to reach populations. Focus groups are, in essence, group interviews where participants discuss topics guided by a moderator. Generally, they're generating insights through group interaction. And that's what's really great about them, because they are really aligned with this idea of capturing shared norms or societal norms that are shared, or collective meanings within groups or segments of the population. You can use them to explore community level perspectives and group dynamics such as agreement, disagreement, and even power dynamics. Their strengths is that they encourage interaction and diverse viewpoints. They're really efficient for gathering a wide range of opinions quickly, in comparison to in-depth interviews. But they may not be as great for when you're focusing on sensitive topics. And sometimes it can be difficult to manage focus groups when there's dominant personalities. Some other things to keep in mind in terms of facilitating focus groups. It's really important to have a skilled moderator or to have, if it's your first time, make sure you have developed a protocol on how you're going to facilitate the focus group, and that you practice doing moderating a focus group, so that when you are actually conducting the real focus group, you are better able to manage dominant voices and encourage quieter participants while ensuring that you are, if you're using let's say, a more structured or semi-structured guide to facilitate the focus group, you want to make sure that you're covering all the aspects of or topics that are included in the guide. Let's see. I think we covered, the only limitation that I didn't cover here in the previous slide was that of social desirability bias. So, when you are conducting focus groups, sometimes you may be covering a topic that where social desirability bias may influence people's responses, because it is human nature to want to be accepted, right? So just some best practices in conducting data or in doing data collection for qualitative research. It's really important to build trust and rapport with your participants, because it ensures this open and honest communication during the data collection, and you're more likely to get a greater breadth and even depth of insights if participants feel that they can be open and honest, and what they're sharing with you will be is with somebody that they trust. Also, it's really important to have a protocol that ensures that you're conducting the research ethically. You want to even with qualitative data, you want to make sure you involve informed consent that from the participant, that you ensure confidentiality, and that you conduct the research in a way that promotes cultural sensitivity. And of course, doing the research in a way that promotes cultural sensitivity throughout the process, that sort of feeds back to the first area of building trust and rapport. Best practices, using open-ended questions, and also having some probing questions to encourage that detailed, rich responses from participants, especially in the beginning of the focus group or interviews, because people can be a little shy as they're developing that rapport with you as the researcher or with the rest of the focus group participants. And then reflexivity and credibility. So it's really important to acknowledge, researcher biases and positionality, because that will strengthen the credibility of your qualitative findings. So for example, in my work on skin tone bias, and or colorism and maternal health outcomes, in my qualitative work, it's really important for me to acknowledge my privilege, right? That I may be afforded because of my skin tone, right? So speaking to that positionality, because qualitative research is subjective to some degree. And so we want to be transparent about where we are situated with respect to the participants and their lived experiences and the research question that's being asked and investigated. All right. So just for sake of time, I'm not going to go into too much detail about coding basics or all these different types of coding basics. But one of the key pieces, I think two key things on this slide that I want to make sure we point out is that coding can be inductive or use inductive and deductive approaches, where inductive approaches, the codes emerge from the data that was collected, and deductive approaches were codes that were guided by theoretical frameworks. So these were predetermined codes based on conceptual frameworks that the investigator is basing their research on. And it's important to recognize that coding is an iterative process. So you don't, collect the data and then read through it once, and as you're reading through it, you do all your coding. It is, like I said, it's this iterative process, and it really requires careful documentation in order to ensure transparency and reliability. Oftentimes, an investigative team will read through the data, the narratives, just to acquaint themselves with the narratives before they even think about coding. And then once they've maybe read through the transcripts a couple of times, then and only then do they begin to assemble codes or implement the coding process. And I will, like I said, I will give a few more examples as we move through this. Sorry, I can't talk today. Thematic analyses involves several steps, and thematic analysis is something that is very common in conducting qualitative research. In these steps, what we do is we first familiarize ourselves with the data. So as I mentioned before, we may read through the transcripts or the interviews several times before we even begin to do coding. We then may start to generate some initial codes based on whether we're using an inductive or deductive process. And then we may, in that, we're going to be searching for themes once we've done our coding, we're going to be searching for themes, and then we're going to be reviewing and refining these themes, and then interpreting findings. And themes represent really this pattern across the data set. So, for example, we, in reading the transcripts across different interviews or focus or from focus groups, you may see several people maybe speak about perceived discrimination in healthcare, and that would become a theme, or communities, different codes speak towards community support as a buffer for stress. And it's important to note that conducting thematic analysis is really this iterative process to minimize researcher biases, and that thematic analysis, it's really helpful, I think, for uncovering insights that inform policy and practice in social epidemiology. There's several different types of tools and software that you can use in qualitative research. It just sort of depends on how large your data set is, and you know, the number of codes that you need to manage. You can, if you don't have access to in vivo or software like Atlas TI, you can literally take the interviews and have them in a Word document or in an Excel table, and do the coding sort of the old-fashioned way, in reading through the narratives and assigning codes to them that way. Data visualization, I find, is really helpful in showing relationships between themes, which helps reveal patterns, or to kind of demonstrate what's the word I'm looking for? I don't want to use prevalence because that's such a quantitative term, but sort of the degree that a particular theme, comes out. So examples of data visualization would be word clouds. You can also use timelines and illustrative diagrams. The other thing that investigators often use when conducting their, whether it's interviews or focus groups, is analytic memos and audit trails. So it's really, really important to have a document that tracks decisions that you make along the research process. And this is important because it helps to maintain transparency and rigor. So just I want to use a couple of examples from my research. either research that I've led or that I've been a part of, in which we've used qualitative methods. So in this first study, we looked at, during the pandemic, we were interested in looking at food insecurity among emerging adults. So these are individuals between the ages of 18 to about 25, 26. So looking at food insecurity in relationship to emerging adults, food behaviors and experiences of neighborhood safety and discrimination. And we also wanted to identify resources that were needed to support their health during the COVID-19 outbreak. And so what we did during the pandemic, because things were constantly changing, as you all know, is that we had to conduct this rapid response online survey. And so what we did was we interviewed, or we sent out surveys to people who were participating in this larger longitudinal study. And these surveys included some closed-ended questions and open-ended questions. And so the open-ended questions were used to assess changes in eating behaviors during the COVID-19 and needed resources. But the closed-ended questions were used to assess sort of the prevalence of food insecurity in our sample, or in our sample in the longitudinal cohort, to measure what the food behaviors were and if neighborhood safety or discrimination were prevalent. So in total, there was about 218 emerging adults who participated in this rapid response survey. And of those, there were 62 respondents who said that they were food insecure or food insufficient on the in one of the closed-ended questions. And so based off of the closed-ended question, we identified those 62 who said they were food insecure or food insufficient. And then we use their open-ended survey responses to then look at how COVID-19 or the pandemic had influenced their eating behaviors and what resources they felt were needed. And so in doing the content analysis, it was conducted in 3 stages. And so the initial stage involved just reviewing all of the responses, right? So the first author, Dr. Larson, she just read all of the responses before any codes were assigned or generated. Then once she familiarized herself with the responses, then and only then were did we generate topic areas based off of the comments that were there. And then a third author reviewed all of the open-ended comments from participants based on the initial generation of topical areas and initial codes that were developed, and then assigned those codes to each comment. So this is really nice table because it's a way to sort of visualize the themes and provide examples of the themes that were identified in the data. So some of the overarching themes were that emerging adults changed the amount of food that they consumed. They also changed the frequency of eating food from restaurants. They started preparing more food at home, and COVID-19 caused them to change the patterns of food shopping. And so with each column, we're getting a little bit more in depth into the theme. So for example, in terms of changing patterns of food shopping, we saw sub-themes that broken down into sub-themes of frequency of shopping, as well as the quantities of food that was purchased and shortages. And so, sorry, let me go back. This was a couple of quotes from respondents, participants, as examples of those sub-themes. So one participant said, with respect to frequency of shopping, is definitely made me and my family eat more careful in how we spend our money, to having to make sure everything lasts the family so we don't have to run out to the grocery store so much. And then in terms of quantities of food, a participant wrote, I have been purchasing more food each time I go to the grocery store, including many more non-perishables than usual. So just some example. And then by using both closed-ended and those open-ended questions, that allowed us to, the quantitative data allowed us to get at food insecurity prevalence among the 218 emerging adults who participated in the rapid response survey. And we see that a little bit more than a quarter of those participants said that they were experiencing food insecurity during the COVID-19 pandemic. We also were able to assess behavioral eating changes. So we saw that stress-induced overeating became a practice, and that people started relying on non-perishables more, and that they had, and this was true in part because there was reduced access, right, to fresh foods. From some of both the quantitative data and the qualitative data, we were able to note that participants reported increased discrimination, or some participants reported increased discrimination and feelings of not being safe in their neighborhoods, and these things may be influencing their health outcomes, right? And then it also gave us some qualitative insights for policy in thinking about targeted interventions, relief programs, that sort of thing. And then the last example that I want to share is really about how that process of using theory and qualitative data to help you better understand the mechanisms within theory in order for you to, or before you move to quantitative analyses or qualitative methods for research, but also showing you that it's like an iterative process. And so this is my work on looking at racism, colorism, and health, and thinking about how race, skin color, and gender may be attached to unique stressors that can affect maternal and infant health outcomes. So when I first started this work, there'd been quite a bit done looking at experiences of racial discrimination and how that may influence perinatal health outcomes. But there had been no work that had looked at how colorism may lead to or shape perinatal health outcomes. Given the presence of colorism in the United States, and especially the city in which I grew up in, which is New Orleans, I felt that colorism may be equally as important as racism in shaping maternal health. And so what I did was I had obtained data from a large cohort study that had measured mother's skin tone. So it had a measure of self-perceived skin tone in there. And I was able to look at this relationship between a mother's skin color, exposures to racial microaggressions, and delayed care. And what I found was that just in general for Black mothers in this study, that greater experiences of racial microaggressions were associated with delayed prenatal care. But what I found was that women's exposure to racial microaggressions varied by the color of their skin, with Black women at the ends of the skin tone continuums, so at the very light and the very dark, reporting the greatest amount of racial microaggressions. And note that this was in a city that is predominantly Black. And so I was using quantitative data in my initial investigation. But the problem with the quantitative data is that it's only measuring skin tone. It's not actually measuring processes in which colorism may be affecting women as they navigate the prenatal healthcare system, right? Or their daily lives. And this study didn't have that information. And so what I wound up doing was creating the colorism in healthcare study. And its goal was, the goal there was to really identify whether colorism is a social phenomenon that is happening in healthcare settings, and is it affecting the quality of care that people are receiving. And it was also to distinguish experiences of unfair treatment in healthcare, those that were connected to racism from those that were connected to colorism, or to see if they're connected to both. So we explored how racialized experiences in healthcare settings may be shaped by colorism. And so we did this online survey in which we recruited 180 participants. Everybody was above the age of 18, and they identified as part of the Black or African diaspora. And this study was done during the pandemic, so we had to recruit through social media and conducted as an online survey. And we used closed and open-ended questions to gather information about their experiences of skin tone discrimination. Individuals that participated in our study, the health service that they reported on were arranged. There was a breadth of reasons why they were seeking healthcare. And I just want to acknowledge my doctoral student from when I was at the University of Minnesota, Habiba, who is really a collaborator with me in analyzing this data and is using this data for her dissertation. So what we saw, this is from one of the close-ended questions, right, is we were able to look at the distribution of the of skin tone among the 180 participants, and by their stratified by their response to our question of, have you ever experienced differential treatment because of your skin tone in a health or medical care setting? And what is, I think, important to look at is that there really is this like skin tone gradient among individuals who said yes to experiencing differential treatment because of their skin tone within the healthcare setting. So then, based off of the open-ended questions in which we asked people to describe their experiences of differential treatment, Habiba was able to identify these major themes from their responses. So it appeared, their experiences were shaped by microaggressions and everyday racism, with sub-themes as people saying that they were perceived as a threat or perceived as uneducated because of their skin tone. They are also felt that they were stereotyped because of their skin tone. Depending on skin tone, some people felt that their voices were being dismissed. We also noted that people experienced in-group colorism, in which maybe the physician or the clinician team were also part of the Black diaspora, and those colorism experiences occurred from people they identified as being part of their own ethnic group, but they also experienced out-group colorism, right? So where the provider is not from or perceived as being from their racial or ethnic group. And then we also identified themes around how people manage through these experiences or cope with these experiences. And hypervigilance was a reoccurring theme. And so based off of those themes, Habiba was able to develop this conceptual model, which she's called the Colorism in Healthcare Conceptual Model, that highlights, the major pathways by which systemic racism operates through colorism right, to affect people's healthcare experiences. So this is an example of where I started off in researching this topic. I started off looking at quantitative data to just establish that there is this relationship between skin tone and it being a proxy for colorism and it shaping people's access to prenatal care or healthcare, right? To then using qualitative data to see if colorism is a social phenomenon that is affecting their interactions and experiences within the healthcare system and their receipt of quality care. And then we use that to refine our understanding of how colorism expects those healthcare experiences. And then this is just an example, this is my last slide. This is just an example of a way to visualize data, right? So in that same study, we asked participants to, we used a closed question for them to self-report their skin tone, but we also asked them to complete this open-ended question. My skin tone is, and what you'll see is that there's a varying array of responses where some people just treat it as their response is just a color, right? So we have tan or let's see, a light hue, mid-dark, right? But then we also have people who are ascribing some social meaning to their skin tone, right? So dark and lovely, ebony perfection. It is caramel and beautiful. It is gorgeous. So here we got to visualize all the different ways that people interpreted this open-ended question to describe, when we asked them to describe their skin tone. And we really got a beautiful array of insight in colorism or in skin tone being a social construct. So I'm going to stop there and for questions.
Wow. Thanks very much, Prof, for this very insightful presentation. I hope everyone was really having a good time from their end over there as me here. This was really in-depth, and coupled to the fact that you showed us your own experience with your research, and yeah, it was very interesting, and yeah, we are grateful for your time. So while Prof is taking a little rest, if you have any questions, please you can feel free to raise up your, use the raise up sign on the here, and then you can ask your questions, please. Yeah, Amma Bishop, please go ahead.
Okay, am I audible?
Yeah, evening.
Okay, thank you for giving me the chance. So I would
Can
like
you
to
just
thank you for.
Can you just introduce yourself a bit, and then yeah, you give us your questions.
Okay. My name is Ammar, an epidemiologist working as Public Health Emergency Management Officer in District Health Office. So I would like to thank you for Professor Jaime for the insightful webinar. I have a couple of questions. First one is, I have a question on data collection part. So we often record the participants in group discussion and
Oh, can you repeat your question?
Maybe his network is breaking.
Or maybe type it into the chat.
Amma, if your network is breaking, please
So-
just type it into the chat, please.
So some of them
Yeah, I think his network is breaking, so we meet him and then yeah, he could type it into the chat. Yeah, and then while yeah, I just okay. Yeah, Prof, while we are waiting for his question, yeah, I really did like a lot about everything you said, and particularly on the side of the collection, the data collection, like using these interviews and focus groups. So my question would be like, for early career researchers, like what are some of the pitfalls that they may, or from your part that you may have experienced when you started doing this kind of research or doing qualitative research, and what are the main challenges that you expect that they should face, and maybe how can they easily avoid such, so that they can get data? Because like you said, this requires some communication skill, and it's not easy to be able to talk to people and get the right information that you want. And maybe what are these some of the pitfalls that they can try to, that they may witness, and how can they avoid them? So
Yeah, I think that's a really good question. I would say the biggest thing that one of the most important things is to practice, especially if qualitative data is not, what you're most versed in conducting. So, make sure you draft that protocol that you're going to use, that guide, semi-structured guide that you're going to use for your interview or your focus groups. Have other people read through it to make sure that the questions are asked in and probes are respectful, that and practice using that guide with people before you actually use it with participants. I would also say it's really important to think about how you're going to capture the data, whether you're going to be able to record the interview. I'm seeing that some Amar's question about some participants may not want to give consent to record. I think that's a really great comment. So you have to sort of think about whether or not you're going to, instead of recording and creating a transcript that way, maybe you're going to take notes, right, of major themes that pop up during the interview and the focus groups. And when you have that kind of situation, it's really great to have a collaborator with you, or a research assistant with you, who, as you are facilitating, they can be the note taker, right? Because it's really hard if you're a person who's not great at multitasking, like I am. I'm horrible at it. I cannot facilitate and be the primary note taker at the same time. So I may write down some high level notes, right? But that's really to help me in further facilitating the interview or the focus groups. But I'm really relying on having a a scribe or a note taker who can capture some of the major themes and comments and maybe some examples that may pop up. Even when I have, let's say I have permission to record during the interview or the focus groups, I still often have a note taker with me. I find it helpful, especially sometimes people speak rather low and it's hard to hear some things. Just find it very very helpful. Let's see, the other question is, how do we conclude research when there's different opinions from participants? For example, food consumption during COVID-19, some eat less and then some eat more. So that's one of the beautiful things about qualitative data, is that it is trying to uncover the processes that are unfolding, right? And it's not an either or situation, like true, false, but it's perfectly okay for both things to be true, right? That some people during the pandemic ate more, some people during the pandemic ate less. But what is really helpful about qualitative data is that it allows you to delve deeper into why, right? Some people ate more and some people ate less, right? Is it because some people ate more because of, stress processes that were occurring, right? Or they were, I don't know, just change in behaviors because they were in their house more, they weren't able to be outside more, right? Or did some people eat less because their income was affected during the pandemic, right? Which did allow them to have to really be more purposeful about the food that they bought and stretching the food, and where their resources that were available to them that they could use to support like food pantries to support their meals, that sort of thing. So that's what's really nice about qualitative work, is that both things can be true, but you get to find out the why and the how both things can be happening at the same time. Whereas quantitative data, you might have only just been able to capture that some people were eating more and some people were eating less. And so then you're left with trying to understand whether or not your question that you had people, or your survey that you had people answer, is flawed, or whether or not these are two things are both happening at the same time, and hypothesizing for what reasons why. Does that help?
Yeah, I think he responded, yes. Okay, thanks very much, Prof, for the response. Yeah.
Yes, absolutely. Feel free to connect with me via LinkedIn.
Yeah. So, Prof, we're in this era of AI now, and maybe you didn't use it a lot in your research at the early beginning, but now, like, what is your take about it in maybe like analysis of qualitative data? Like, can you share us some, like, how can we properly integrate it into our work and use it? Because of course it makes it better now. I think AI sometimes make analysis, maybe the thematic analysis, the coding. I don't know how you did it in the past. Maybe you had to, there were some strategies you used, maybe, but how, like, in this current era, how do you look at the differences, and like what advice can you give to us researchers in this era, like how to properly use AI in this kind of research?
Yeah. That's a really good question. So some qualitative people who are like formally trained in qualitative research, they support using AI, right, in the data collection and or data processing and analysis phase. Other people don't. I think it has its place, right? And it has to always be supervised because AI is only as good as you trained it to be, right? You still need to familiarize, like if you do 10 interviews with people, right? You still need to read through the transcripts of those interviews or the notes that you took during those interviews and familiarize yourself with those and go through the process of developing the overarching themes and codes and that sort of thing in order to, I think, ensure that AI isn't hallucinating, right? That AI is has an understanding of a social phenomenon, right? AI is only knows what it's been fed, right? I think some places where AI is very good, I think, and it's a no-brainer, is in transcription, right? So during, even before COVID, but definitely during COVID, we've seen this uptick of conducting interviews and focus groups through programs like Zoom or Google Meets or other apps. And, you can use AI to generate that transcript, right? And then you download that transcript, and that is, what you then begin reading through. And then you can actually upload that document to your in vivo or your Atlas TI or whatever other software that you're using, and then go through the process to manually you do your coding, that sort of thing. So I think there's a place for it. I think we're still trying to decide how much of a place is okay for it, right? But I think regardless, there has to be some supervision with it.
Okay, Prof. So thanks very much about for the response. So like for the coding, generally which tool do you use from your research? Like which tools do you use for coding? Also for thematic analysis, do you use any tools, or you have to come up with them by yourself?
So I've used I've done focus groups in Zoom, and which allows me to download the transcript that way. In terms of software that I use to help assign codes, I've not used in vivo that much, although, but that's just because I'm a little bit of a relic. And Atlas TI was the most popular software for doing qualitative coding and analyses when I was in school. So that's what I'm most comfortable with using. But for the colorism in healthcare study, we actually did it the old-fashioned way and didn't use we didn't use survey things like in vivo or Atlas TI. I'm trying to see if I can pull up really quickly an example of what that looks like. Give me 1 second here.
Are these tools free?
Yes, so this is, you can, what I'm about to show you, you will be able to do, you will definitely be able to do. Okay, so let me share my screen here. So what I did was, in our survey, oh, we can't, let's see, is it not sharing? Try this again. Okay, can you see my screen?
Not yet. Let me open this a different way. I'll share it on it or I'll just copy and paste this in a Google Doc because we know that my Google shares. Okay. Okay. So these were responses from the colorism in healthcare study. So participants were asked this one question. Let's first start by defining what colorism means to you. How do you feel your skin tone relates to the skin tone of other people who identify as Black? Do you think people see you as different? And so what we wound up doing was, each participant was assigned an ID. And so for this particular question, we took participants' responses and we put them into this table. And so what me and my team did, and I had a team of like, there's probably like 4 of us total, is that I made this, they each had access to this document. We all read through the participants' responses a couple of times before we even started making notes of themes. And then we each on our own went through and started to name some themes that we, and we would enter them in this column. Then what we would do is we would meet weekly, and we would discuss the themes that we each had identified for the participants' responses. So what we were sort of looking for was alignment, right? Or agreement between all of us on the research team
in terms of what that theme was called, right? And if there was some disagreement, then we would kind of talk about why, you know, one person called it something else and another person called it something totally different. So I don't have the codes written here in this one, but let's see, try to think. They're trying to find one. But just for sake of time, like one of the themes that popped up was colorism awareness, right? And we found that theme, the degree of awareness varied by participant's skin tone. So one of the things that we did was, once we coded all the questions, all the comments, we went back and looked up the participant by their ID number, and we looked to see if they ascribed or identified as very light, medium, you know, dark to very dark complexion, right? And so then we wound up dividing all of the coded comments up by the skin tone category that the participant reported themselves in. And then we looked to see how frequently, or the frequency in which certain themes popped up in, right? So for participants who reported very light to light brown skin tones, they were more likely, and when I say more likely, I don't mean like statistically, but what we saw with more frequency was them saying that they weren't aware, they never experienced colorism, but they were aware of colorism, and that maybe their husband or their friend or another family member who was of a darker complexion taught them about the privilege that is held or associated with lighter complexion, so that they have an understanding of their privilege. And so like another theme, like a sub theme under colorism awareness, was we had like a colorism broker, right? And so that broker is that person that helps another person understand what colorism is, and privilege and disadvantage that may be associated with it. And so then once we'd worked through all of the comments, that's when Habiba started kind of further looking through and grouping some of the smaller sub themes into larger themes, etc. And you see the conceptual maps that I presented. So
yeah, thanks.
So this is the
Prof.
old-fashioned way of doing it.
Yeah,
like if you can't afford the in vivo or the Atlas TI, you can always do it this way.
Okay. Wow. Thanks a lot, Prof, for giving us some of your experience. And yeah, we are really happy for everyone who has stayed up to now. It has been a long session. Yeah, we are 30 minutes over time plan, but I think it was worth it. And it's not easy having somebody of this status like coming to give you knowledge for free. Sometimes you have to pay for it, but we are having it here for free, so it was worth the time, and we are very grateful for that. And for all of you who joined, we are happy that you joined. Please, you can follow us and follow Prof also on LinkedIn. Like she said, follow us on LinkedIn, our group page there, and yeah, so that you are updated with the current activities and upcoming webinars as well. So yeah, for for today, we would like to call it off. And yeah, we say again, thank you very much, Prof, for your time and your availability. And again, yeah, we look forward having you here for more sessions. And of course, we have more projects we are collaborating at the background, which I will send you updates very soon. So thank you very much. And yeah, have a nice weekend. And yeah, hope to see you in another session. Thank you very much. Bye.
Yeah, thank you. Bye.